How are you feeling today? Happy, sad, angry, frustrated, excited? We all go through these emotions and moods throughout the day. That's pretty normal. But if you or someone you know is feeling sad and that feeling persists for days, weeks, or even months, then it could be depression. We need to remember that there is a difference between feeling depressed and having clinical depression. We will discuss the most common signs of depression to watch out for. Have you noticed a drastic change in the appetite of a family member, a co-worker, or a friend? It could be a total loss of appetite, that they have lost interest in food. Or maybe they have started non-stop binging and using food as comfort and are gaining weight rapidly. A sudden but unexplainable loss or gain of appetite or weight is a sign of depression, so do not ignore it. As depression drastically depletes the energy levels, a depressed person might not care for their daily hygiene anymore. Depressed people might not shower for days or weeks. They won't comb their hair or even brush their teeth. Depressed women might stop wearing makeup or getting dressed up. Men just stop shaving. These are all red flags, and if you observe them in anyone you know, it's time to talk to them to seek medical advice. Have you observed that someone around you gets irritated and frustrated easily? Like they do not like anyone anymore? Every little instance triggers a breakdown. They are always in a bad mood and they were never like this. They lose their temper very easily. Then it's a good idea to talk to them, ask them about the reason. Convince them to seek professional help. Another classic but easy to miss sign of depression is feeling numb, useless, worthless, and aimless. Depressed people are incapable of feeling anything. It's not like they are sad. They just don't feel anything at all. Also, they lose their self-esteem and self-confidence. If all they do is negative self-talk, this is definitely a red flag. Seek professional help immediately if a person expresses that his life is not worth living anymore. You have anhedonia. Are you unable to enjoy the interactions, the activities, the experiences, or the food that used to bring you joy? Do you feel like nothing interests you anymore? You have lost the desire to be a part of activities that used to be fun? This is a condition called anhedonia, and this is a sign of depression. There is a sudden shift in the sleep pattern. It could be insomnia or hypersomnia. Either you are unable to sleep or you are sleeping non-stop, like for 16 to 17 hours per day. If you aren't taking any stimulants in late evening like coffee or anything and still you cannot sleep at night, this is something you should definitely discuss with your doctor. And as depression makes you very lazy and lethargic, it could be that you cannot get up in the morning. That's why usually depressed people sleep for longer hours than most of us. These are the common signs of depression. If you observe them in a family member, friend, or a colleague, or in yourself, seek professional help to get a proper diagnosis, treatment, and therapy.